Our next guest is Dr. María Nápoles, Scientific Director of the National Institute on Minority Health and Health Disparities. She is the first Latina to be named to the position at the National Institutes of Health. Welcome, Dr. Nápoles.
Thank you very much, Rafael.
Well,
I love the way you pronounce my name.
Yeah, I am a Spanish first speaker, but on that point, I wanted to get, how's your background? How was growing up as a Latina sort of feed into your decision to end up in the medical sciences and make a career in the medical sciences?
Well, my background is, and it's very similar to what some of the other women have indicated. My parents were both immigrants from Jalisco, Mexico. They were from small rural villages, and my father never went to school. My mother went to the 3rd grade. And so when they immigrated to the US, they saw education as a way out of poverty. And so for them, it was very important that me and my 2 siblings go to college. And I went on to get a graduate degree in public health and a PhD in epidemiology. And so that was very much, that career choice was influenced by my childhood. We lacked health insurance, so I had illnesses, the infectious illnesses like diphtheria and measles because I was not vaccinated. I served as the interpreter at my mother's medical visits and saw how important it was to communicate well with physicians, and they understood and could ask questions, that I could do that on behalf of my mother. So all those factors, as well as working in a women's health clinic and then seeing how cultural factors influence women's medical decision-making, healthcare decision-making, all influence my career choice.
So first of all, great shout out to Jalisco, Arriba Jalisco. But I wonder if you can go a little bit more in depth, like these cultural barriers that have prevented Latinos in the country from getting the right kind of medical care. Sort of what damage have they done, and have they improved over a certain period of time? Let's say the last 25 years.
So I tend to avoid or not use the word barrier because I think that the implicit assumption there is that culture is getting in the way, right? And in many cases, in the cultural traditions that Latinos have are what explain the Latino paradox potentially. So, and what I mean by that, so there are, when you look at the evidence, we know that immigrant Latinos in the US generally have better health profiles than US born Latinos and Latinos that have been here if they're immigrants for a longer period of time. So they begin to look more like the dominant white culture in terms of their health behaviors, increased smoking rates, increased alcohol use, more sedentary behaviors, that type of thing. So we don't know, in general, Latinos tend to live longer in the US than whites, than their white counterparts. And by white, I mean non-Latino whites. And they also generally do better in terms of the 2 biggest killers, which are heart disease and cancer. And so we really don't know all the factors. So there could be a lot of protective cultural factors that enhance and sustain positive health behaviors or positive social networks that we know are associated with better health outcomes. But there are disadvantages. We know that Latinos are 3 times more likely, as I mentioned, not to have health insurance. We know that generally they tend to be more well represented in hard labor occupations, service occupations, that they generally have a lower educational level, lower income, average income than whites. And all those factors can create disadvantages in terms of health outcomes.
I appreciate that idea of dropping that word barriers. I think that's we'll do that here. We'll follow your advice. One quick question before I pass on to my colleague Lex Juarez. In the political world and in polling, we often say that it's really hard to poll Latinos. Pollsters like maybe they have language issues. They don't poll in Spanish and in English, or they don't reach all the communities, or the communities themselves are not as communicated. Do you see a similar difficulty when trying to do the statistical work of finding out what medical science needs to address a community's needs?
Well, what I've learned over, with about 30 years of experience working in Latino communities doing health research that's community-based is you have to go to the communities, right? So, and you have to have people on your team who speak the language, know the culture, live in the communities, and know how to access people who are Latino. And so we're not monolithic, as you know, we're very diverse. And so that means having diverse research teams and diversifying our research workforce. So I would say, if there's evidence that Latinos are not represented in a lot of health research, it's some of the factors that contribute that are that we're not using the right means, right? If we're using electronic means to do those polls, not everybody has equal access to internet or high capacity internet, right? High speed internet. And those factors can often influence where we see lower response rates in those communities. But community health workers that are from communities in terms of delivering health interventions have been very effective because they know how to work and reach those populations.
Okay, my colleague Lex has a question for you now.
Yeah, you were talking about vaccines at the very beginning and how you weren't able to get some of those. Just this past year, we went through, the COVID-19 vaccine being released, and minorities, not only Latinos and Hispanics, and all minorities being hesitant to take that vaccine, especially when it was very first coming out. To have somebody like you, in such a high position, how do you think that helps people to feel more comfortable about, trying new things that are coming out in healthcare as we continue to progress?
Well, it's interesting because we actually did some early work early in the pandemic, looking where we did a nationally representative survey. And we actually found the opposite, that it was Latinos, especially Spanish-speaking Latinos, who were more willing to be vaccinated. And their rates are actually higher or equal to whites at this point. And they're very much interested in the COVID vaccine. And I think a lot of that is driven by the impact, the disproportionately horrible impact it's had in our Latino community in terms of, the exposure either due to their service occupations or living in homes, all those factors that increased their risk of exposure to COVID and poor outcomes and access. But definitely, I think getting the word out there, a lot of intensive efforts were made at the community level and in Spanish to increase those rates. But I think even before those activities were conducted and initiated, there was a disposition to be vaccinated because people were seeing the impact in their communities.
And so, do you find yourself taking any extra kind of responsibility or feeling that weight to be a representative for the greater Latino community? And how does that kind of manifest in what you do every day when you're headed to work?
I guess I don't see it as a weight. I see it as my calling, right? It's a service. It's what,
right, absolutely.
It's a fundamental value that, was instilled in me as a child is we're here to serve others. We're here to give those who don't have a voice or feel disenfranchised in our society. We're here to provide that for them if we're in a position where we can do that. And we're here to give them that voice back. They can take it. They should be advocating for their communities and can advocate. And I guess that's the mentality I came in with in this occupation. I'm here to serve you. I'm here to help you. You have resources, you have strengths in your communities. Let's use those strengths to better the health of our people, of our comunidades.
So we've been asking a version of this question to a lot of our guests today. What can be done to build on your success and build on the success of other women, especially in science, in the medical sciences, to get future generations of Latinas who understand these cultural distinctions that can give better medical access to the whole community and to other communities?
For us, at the National Institute on Minority Health and Health Disparities, having these programs where we're making an intensive effort to diversify the biomedical workforce is critical. We're trying to, anyone in my position, I feel, is obligated to extend the hand to those that come behind us and create those opportunities and promote candidates that are qualified, that are diverse, and can get the job done, and can also be advocates for their communities where they come from.
Dr. Ana María Nápoles, Scientific Director of the National Institute on Minority Health and Health Disparities. Thank you so much for joining us today.
Thank you so much.